Welcome back, everyone, to AI Analysis. I'm Stanley, and I'm so glad you're joining us for another deep dive into some fascinating research.
Hi, everybody. I'm Agatha, and I'm here to help guide us through the science.
Perfect. So this time we're taking a look at the Lancet, February 24th, 2024, issue 10428.
Oh, that's a good one.
Yeah, it is. And as always, if you want to check out the full articles yourselves, the links are in the description.
We always want you to be as well-informed as possible.
Exactly. So are you ready to dive in?
Let's go.
Okay, great.
Yep.
Let's kick things off by talking about healthcare around the world.
Oh, a big topic.
Yeah, it really is. And one article that stood out to me was about a situation in Nigeria. It's by Nicholas Adarinto, Emmanuel Kokori, and Gobolahan Olatunji, and it's about a doctor who died after working a 72-hour shift.
Oh my gosh, 72 hours?
I know, right?
That's almost unbelievable.
It really is. It's a tragic story, and it really highlights a bigger problem in Nigeria's healthcare system.
It really does. Doctors there are just pushed to their limits, working crazy long hours with very little support.
I can't even imagine. 3 whole days without sleep. It's no wonder this doctor couldn't handle it.
Well, and what's even more scary is that this isn't just one event. This is happening a lot. The authors found that Nigerian resident doctors work an average of over 100 hours per week.
Whoa. Way more than doctors in other countries.
Oh, yeah. And surgical residents work even longer.
That sounds like a recipe for disaster.
Mm-hmm.
Not just for the doctors, but for their patients, too. You know, how can anyone expect a doctor to make good decisions after being awake for that long?
You're right. And the authors talk about how all this exhaustion and burnout leads to medical errors, which obviously puts patients at risk. But it's not just the long hours. It's also that Nigeria has a huge shortage of doctors.
Oh, so it's like a double whammy. You got
Yeah.
doctors working way too much and not enough doctors to begin with.
It's a terrible combo. And to top it off, a lot of experienced doctors are leaving Nigeria to work in countries where the conditions are better and the pay is better.
Oh, man. That's just a vicious cycle.
Mm-hmm.
So is there anything that can be done about this? Did the authors give any solutions?
Yeah, actually they did. They suggested things like putting strict limits on how many hours doctors can work, giving them more support and resources, and also improving their pay and benefits to make the job more attractive.
Right, make it worth staying.
Exactly. And they also talked about training more doctors within Nigeria to try and help with the shortage.
Okay, so it sounds like a lot needs to change.
Yeah.
But I'm glad these authors are shining a light on this issue.
Me too. It's really important because access to good healthcare is a global problem.
Well,
There are people everywhere fighting for basic rights that a lot of us take for granted.
you're absolutely right. And speaking of global healthcare challenges, there's another article in The Lancet that talks about Italy, specifically the Calabria region, which is facing a healthcare crisis too.
Oh, yeah, that one.
Yeah. This report is by Francesco Pata, Daniele Paglione, Elvis Pardo Olivares, Ernesto Casimir Calles, and Bruno Nardo. And it's kind of similar to what we just talked about in Nigeria.
You mean overworked doctors and staff shortages?
Bingo. But there's a little twist to this one. So while Italy as a whole has a pretty decent healthcare system, the Calabria region has fallen behind. They're dealing with rising costs, a system that's fragmented, and a major shortage of doctors.
Especially in the rural areas.
Yeah, so what are they doing about it? Are they trying to recruit more doctors from other parts of Italy?
Well, they are trying, but not necessarily just from Italy. They've come up with a pretty unusual solution. They're partnering with Cuba.
Cuba. That's pretty cool.
Yeah. So Cuba is known for having a good healthcare system, even though it's a developing country. They have a lot of well-trained doctors.
So Calabria is bringing in Cuban doctors.
That's right. They're working in their hospitals and clinics.
Wow. I wonder how that's going.
It seems to be helping. So by early last year, they already had over 270 Cuban doctors working in Calabria, and they're planning on hiring even more by next year.
That's awesome.
And the report even says that these doctors have been essential in keeping some hospitals from shutting down completely.
That's amazing. So this is a case where a country with less resources is actually helping out a country with more resources.
Mm-hmm.
It's interesting how these things work out.
Yeah, it shows how interconnected we all are and that sometimes solutions come from unexpected places.
That's a good point. So let's zoom out a little bit and look at the Italian healthcare system as a whole. There's a debate happening about whether the system needs a complete overhaul or just some minor adjustments.
Right, and this debate is started by an article by Ariana Magan and Rosario Caruso.
They're arguing that the biggest problem is a lack of funding.
Exactly. They say the Italian government needs to put more money into healthcare if they want to see things improve, especially in places like Calabria.
Yeah, that makes sense. It's tough to have a good healthcare system without enough money. But I thought Italy had universal health care like a lot of other European countries.
They do. But even with universal health care, there can be problems with how the money is being used and how well the system is run.
So what's the other side of this argument? What are people saying who don't agree with Magan and Caruso's view?
Well, there's another article in The Lancet by Livio Garattini, Alessandro Nobili, and Giuseppe Ramuzzi.
Okay.
And they have a different perspective. They agree that the Italian healthcare system has problems, but they don't think throwing money at it is the solution.
Interesting. So if it's not just about money, what do they think the real problem is?
They think one of the biggest weaknesses is the primary care system.
Primary care.
Yeah. So in Italy, general practitioners often work alone without much connection to hospitals or specialists.
I see. So they're saying the foundation of the system is weak, which causes problems down the line.
Exactly. They think if Italy wants to improve healthcare, it needs to start by strengthening primary care,
Right.
give general practitioners more support, integrate them better into the system, and encourage more collaboration between doctors.
I see. That's a really important point. This debate brings up some big questions about how we view healthcare. Is it all about money, or are there deeper issues that need fixing?
That's a great question, and something to really think about. It really is. So let's move on from healthcare systems and talk about someone who really made a difference in medicine. Dr. Barer Strauch.
Okay.
He was a pioneer in microsurgery.
Okay, microsurgery.
Sure.
So we're talking about like really, really tiny surgeries.
Exactly, like operating on the tiniest blood vessels and nerves, things you can barely see with the naked eye. There's a great obituary for Dr. Strauch in this issue of The Lancet, written by Jeff Watts. It really highlights his incredible career.
Wow. So what kind of things could you actually fix with these tiny surgeries?
Oh, he wasn't just fixing things, he was revolutionizing plastic surgery. He developed all sorts of new techniques and specialized instruments to do these really intricate procedures.
That's pretty cool. Do you have an example of something groundbreaking he did?
Well, one of his most famous cases was a New York fireman who lost his thumb in a fire. Dr. Strauch did one of the very first successful toe-to-thumb transplants.
Oh, no way. He took a toe and made it into a thumb?
Yep, it allowed the fireman to go back to work.
Wow, that's incredible. Imagine the skill that must take.
It's really remarkable, and he didn't stop there. He also developed a special clamp for reversing vasectomies.
Really?
Yeah, and a device to help with penile erection.
Huh.
And get this, he even explored using leeches
Leeches? What for?
to help remove blood after microsurgery.
Wow, leeches. You don't hear about that very often.
I know, right? But it goes to show that sometimes the old ways are still the best. Dr. Strauch was always looking for creative solutions. He was a true innovator.
That's really cool.
Yeah.
But, as we keep advancing in science and discovering all these new possibilities, we had to make sure we're doing things ethically.
That is a really good point. And speaking of ethics, there's an editorial in this issue of The Lancet about something pretty worrying. The rise of research misconduct.
Oh, wow, that's not good.
No, it's not. The editorial talks about how in 2023, over 14,000 scientific papers were retracted.
14,000, that's a lot.
It is. It's the highest number ever. And a lot of those papers were linked to paper mills, reviewer mills, and fraudulent special issues, many associated with a publisher called Hindawi.
Hold on, paper mills. What are those?
Basically, they're like factories churning out fake research papers. Some researchers feel pressure to publish as many papers as they can, so they buy fake research from these mills.
So it's like academic cheating on a huge scale.
Yeah, pretty much.
Yeah.
And it's not just the paper mills. There are also reviewer mills that provide fake peer reviews to make the papers look legit.
Oh, wow. So it's like a whole system of faking it?
Right. It really undermines the whole scientific process.
That's a huge problem.
Mm.
So what can we do about it?
Well, there are some things happening like the Declaration on Research Assessment or DORA and the Hong Kong Principles.
What do they do?
They encourage a more well-rounded evaluation of researchers looking at more than just the number of papers they've published.
That makes sense.
And there's also COPE, the Committee on Publication Ethics. They're working to prevent the manipulation of special issues. And then you have groups like United 2 Act who are actively fighting against these paper mills.
Okay, so it sounds like there are people working on this, but it's got to be an uphill battle.
It is, but it's important work. So why do you think people do this? Like, what's the motivation behind all this fake research?
Well, you said earlier that there's a lot of pressure in academia to publish.
Yeah.
It's like the key to getting funding and promotions.
Exactly.
So maybe some people just feel like they have to take shortcuts instead of doing the real work.
That's definitely part of it.
It's a shame, though,
Right.
because it makes people lose trust in science.
You're right. If we can't trust the research, then what can we trust?
Exactly. So this issue of research misconduct is something we should all be thinking about.
Agreed. So let's shift gears now and talk about a study that thankfully does seem to be the real deal.
Okay.
It's called the INSPIRE study, RSV infection during infancy. Yes. And it looks at the connection between a common respiratory virus and the development of asthma in children.
Okay, so this is something a lot of parents will be familiar with, RSV.
Right, exactly. Respiratory syncytial virus.
Yeah, it's really common in babies and little kids.
It is. Most kids get it at some point.
I know I did when I was little.
But what the study found is that kids who don't get infected with RSV during their first year of life actually have a lower risk of developing asthma later on.
Really? So getting RSV early could actually make you more likely to have asthma later.
That's what the study suggests. They found that children who weren't infected with RSV in their first year had a 26% lower risk of developing asthma by age 5.
26%. That's a big difference.
It is. But we always have to be a little skeptical of any study. Were there any issues with this one?
Good point.
Well, some researchers raised concerns about the study's methods. They questioned things like the limited range of birth months included and whether the RSV infection rates might have been overestimated.
So they're saying the results might not be totally accurate.
Potentially. But the researchers who did the study responded to these criticisms. They defended their methods and said that they did take into account both symptomatic and asymptomatic RSV infections.
Okay, so it sounds like there's still some debate going on.
There is. But it definitely brings up some interesting questions about the link between early childhood infections and asthma.
It does. And this is why it's so important to talk about scientific research openly and honestly. We have to question the methods and the conclusions, but we also have to be open to new ideas.
Well said. Now, before we finish up this part of our deep dive, let's switch gears one more time and talk about something very urgent that's happening right now. The humanitarian crisis in Gaza.
Yeah, this issue of The Lancet has a report by Ghada Al-Jadba, Wafa Zaidan, Paul B. Spiegel, Tamer Sher, Sana Najjar, and Akihiro Seda. It's really eye-opening about what's happening in Gaza. It's just heartbreaking to read about the conditions there.
It really is a massive humanitarian crisis. As of January 30th of this year, over 75% of the population is displaced. That's 1.7 million people. And over 26,000 people have been killed. Access to basic things like healthcare is so limited.
Yeah, the report focuses on the impact on UNRWA, the United Nations Relief and Works Agency. They're basically the main healthcare provider in Gaza. Can you explain what they do?
Sure. So UNRWA provides a bunch of services to Palestinian refugees in Gaza, like education, social services, and healthcare. Before the war, they were running 22 primary health centers serving over 1.3 million people.
Wow, so they were doing a lot.
Yeah, but obviously the war has made it nearly impossible for them to keep operating at that level.
Right. I mean, the demand for healthcare must be huge. I can't imagine the remaining staff have enough resources.
You're right. The report says that daily consultations at UNRWA facilities have jumped from 15,000 to over 23,000.
Oh, wow.
So each healthcare worker is handling twice as many patients as before the war.
That's insane. I can't even imagine trying to do that. And what about the people who are displaced? They're living in shelters, right?
Yeah, and the shelters are way overcrowded. There are like 18,000 people crammed into each one. And basic things like clean water are really scarce. The report says people are only getting about 8.8 liters of water per day, which is way below the minimum for emergencies.
That's just awful. It's
Yeah.
going to lead to so much sickness. And I remember reading about attacks on healthcare facilities, too.
Unfortunately, yeah. As of January 30th, there have been 342 attacks on health facilities in Gaza.
Are you serious?
It's true. It's resulted in 627 deaths and 783 injuries. It's a clear violation of international law, and it's just devastating for an already struggling healthcare system.
It's hard to even process all this suffering.
Yeah.
But it's so important that this report is highlighting what's going on.
It really is. The international community needs to do something. The report calls for a ceasefire right away, and they urge countries to help support the existing healthcare infrastructure and workforce in Gaza. They need to focus on providing things like wound treatment, rehabilitation, and mental health support.
Yeah, those are all crucial things. It's a reminder that even with all the amazing scientific advancements we've talked about today, there are still places where people are just fighting to survive.
You're right. We have to remember both sides of that, the potential of science to help people and the reality of suffering that still exists.
Well said. Well, I think that's a good place to end our deep dive for today. We've covered a lot, from the healthcare struggles in Nigeria and Italy to the incredible world of microsurgery and the worrying trend of research misconduct.
And of course, the urgent humanitarian crisis in Gaza. It's a complex world out there with amazing progress and heartbreaking challenges.
Absolutely. So to all our listeners, I really encourage you to check out the full articles from The Lancet. The links are in the description. Keep learning, keep asking questions, and keep diving deep.
Stay curious, everyone.